Very good news for the speakers arrived after this event was recorded. I'm pleased now to hand over to Dr. Camille Carroll.
Welcome everybody. I'm really delighted to welcome you to this evening's presentations about our new care pathway that we have implemented here in Plymouth, and we call it home-based care. I'm particularly delighted to welcome you to this evening hearing about our service, as we have just won an award for developing it, Digital Innovation Team of the Year, highly commended in the BMJ Awards ceremony this year. The home-based care service represents several years of work developing it, importantly involving people with Parkinson's, their care partners and those involved in their care from Plymouth City, West Devon and East Cornwall. And leading to the development of the service, we undertook a series of workshops kindly sponsored by BL to really understand what people with Parkinson's and their care partners needed from their service. And it is the outcome from those workshops that you're going to hear about this evening. So first up is Emma King. Emma works with me in our Parkinson's research group, and she has undertaken an evaluation of the home-based care pathway. And so you'll really see the impact that this has had in a positive way for people with Parkinson's and also for the staff delivering care. And then you're going to hear from Emma Edwards, who has been instrumental part of developing a home-based care pathway, a Parkinson's nurse who was working in Cornwall and now works with us in Plymouth. So you can understand from her what it's felt like working in the service and delivering it across our region. So I hope that you'll enjoy the presentations. It's been a fantastic 2-year journey developing home-based care, and this is just the start of it for us, having it successfully implemented here in Plymouth. And we hope that this is a way of providing care for people with Parkinson's and supporting them in their care that will be able to spread to other services across the country.
Hello and good afternoon. My name is Uli Funken, and on behalf of Penprick Group, I'd like to welcome you to today's session. Penprick, as you may know, is a group of volunteers, and we are passionate about Parkinson's patients and bringing them and the researchers closer together. So today I'm delighted that we have the opportunity to learn about the home-based care pathway. That's an initiative that's trying to address the ever-growing problem that there are more and more people with Parkinson's being looked after fewer and fewer healthcare professionals and neurologists and nurses. And we have 2 experts on the topics here with us. I'd like to welcome Emma King, who is a research assistant with Plymouth University, and also Emma Edwards, who is a Parkinson's specialist nurse and works in the Plymouth community and was a member of the working party for the pathway from its conception. So I'd like to hand over to Emma King, who will be our first speaker. Go ahead, Emma.
Hi. I'm just going to give you all a bit of background about the home-based care pathway. So what it entails, how we got to where we are, and how we've been working to evaluate it. So first of all, what is home-based care? So simply put, it's an alternative to standard care, which focuses more on people with Parkinson's managing their symptoms at home while being supported by their medical team. So this means that they won't have scheduled clinic reviews with clinicians, but instead will be able to contact their care team when they feel that they need the support. So we've developed this pathway from a small service evaluation that was done a few years ago now. It showed that people with Parkinson's and their care partners weren't as satisfied with their care as they could be. There were various issues such as long waiting times between appointments, often more than a year at a time. People found traveling to clinics was often burdensome, and they just wanted to take more control of their care and find out how they could better help themselves. So people quoted wanting to have a book of knowledge, so a resource that they could turn to whenever they needed, instead of having to wait for a scheduled clinic. So this led to the development of the home-based care pathway. We held a series of workshops where professionals and people with Parkinson's discussed exactly what should be included in a home-based care pathway. From these workshops, the resource pack that's pictured here was developed. So this pack includes information about Parkinson's, such as managing symptoms, and also what to expect from the home-based care pathway. This pack is given to people with Parkinson's before a training session. And at the training sessions, this is delivered either, well, initially it was delivered face-to-face, but then COVID happened. So we've moved to delivering training sessions remotely through sort of group video calls like Zoom or Attend Anywhere. And these are used to explain how to effectively use the resources to self-manage, and also how to contact the team if a sort of face-to-face or video review is required. So included in the resource pack, there are these symptom tracking cards. Each card provides information about either a motor or a non-motor symptom and can direct the reader to the appropriate page of our Parkinson's introductory guide for more information. So these cards allow both people with Parkinson's and their care partners to monitor both new and existing symptoms. Some of the cards have a red warning label, as you can see on this screen. So these are used to identify symptoms that shouldn't be ignored and should be reported to the care team if they're new or worsening, because they might require a triggered review. Similar to the symptom cards, we also have activity tracking cards. Each card has a different activity, and on the back, it details some of the possible reasons for that activity and directs the reader to the appropriate symptom tracking card. So from here, the reader can then get further information from the symptom card to help manage whichever symptom they think is affecting that activity. So the symptom cards are used in conjunction with these heat maps. So these allow symptoms to be monitored over a period of time, such as over a period of weeks. There's also space at the bottom for more notes. So if a symptom's getting worse and requires a triggered video or face-to-face review, the tracking cards and the heat maps will be able to help provide more information to help during that review. So the idea is that at each time point, you think about the symptom that's sort of been affecting, and you can plot on this heat map how much it's been affecting or how burdensome it is. So you can see green is fine, it's not really bothering, red is more severe. So it's a visual representation of how the symptoms change over time. So we found that people have adapted this resource quite a lot to suit their own routine. So the heat maps are designed to track symptoms weekly, but some people have adapted this into, say, a diary where they track severity of symptoms on a more regular basis, such as daily or even hourly. Another useful part of the resource pack is the rapid deterioration guide. As Parkinson's has a slow progression, rapid deterioration is usually due to an underlying cause such as an infection or constipation. This flowchart allows the reader to quickly see what could be causing their symptoms to get worse, and it provides advice on what to do next, whether that's read a certain page in the resource guide or speak to your nurse or GP. The resources encourage self-management, but as part of this pathway, people with Parkinson's and their care partners aren't just left to fend for themselves with the resources. Every 6 months, motor and non-motor symptom questionnaires are sent out in the post, as well as a PKG watch to track movement. So the PKG watch is worn for a week, and then it's all sent back to the home-based care team, where the consultant will review the responses and provide a report. So this report will detail any suggestions for actions So if any symptoms have been flagged as being troublesome, then there may be suggestions to change medication, have a review with their nurse, or to contact the GP. If necessary, these reviews can trigger a face-to-face or video conference review if issues need to be sort of discussed in more detail. The face-to-face or video reviews can also be triggered just by contacting the home-based care team through the telephone or email. Any queries triggered then will be sent to the appropriate member of the team, and for example, a nurse or consultant, and a review will be set up with the right person. So that's an overview of what the home-based care pathway entails. We've had people on this pathway since October 2019, and since then we've trained 157 people, with 150 still active on the pathway. We've since been evaluating this pathway in terms of 4 areas. Is it acceptable to people with Parkinson's, their care partners and staff? Is it feasible to deliver? Is it safe? And is it effective? We've looked at the data from the 6-monthly motor and non-motor symptom questionnaires, as well as by conducting interviews. So as part of a qualitative study, we did some semi-structured interviews with people with Parkinson's enrolled on the pathway, and their care partners and staff members working on the pathway. So these interviews showed that both people with Parkinson's and their care partners felt more empowered to self-manage, and they felt a greater sense of autonomy now that they're on this pathway compared to the care they previously received. Staff members felt that the team was working with sort of a better cohesion than before, and the service itself felt more like an embedded service rather than just a little project, which is obviously what it started out as. So I've got a selection of quotes here from the interviews with people with Parkinson's who were on the home-based care pathway. So in general, the responses were positive, with people reporting that the symptoms were useful and accessible. There were, however, mixed feelings about the PKG watch. Some people thought that it was fine and didn't get in the way. They were quite surprised by how much information the watches could actually provide. Others had difficulties controlling the watch. So the watch itself is set to provide an alarm when medication is due. Some people struggled to swipe the watch and turn the alarm off. Other people felt that self-management in general just wasn't for them, and they'd rather go back to the standard doctor-patient relationship, sort of waiting on a clinic list. So this highlighted to us that self-management isn't for everyone. So those that aren't suitable for this pathway are offered the standard clinical care instead. So we've got some more quotes here. These are from the interviews with care partners. So in general, care partners talked about the lengthy questionnaires that are sent every 6 months. Now, there are quite a lot of questionnaires to complete at each review, but in general, care partners recognise that it's important to have lengthy questionnaires to make sure that nothing's missed. The resources themselves were praised, and people said that the resources highlighted information to them that they weren't previously aware of. Others felt that the resources themselves could be condensed. So we listened to this feedback, and through more workshops with people on the pathway, we redesigned the resources to make them more concise without losing any important information. So those redesigned resources have been sent off to be printed, so they'll be implemented. We also measured acceptability using an anonymous service evaluation questionnaire. This was sent alongside the motor and non-motor symptom questionnaires. Now, compared with the baseline scores at the start of the pathway, after 6 months, people with Parkinson's felt more involved in their care, more listened to, and better treated as an individual. So safety is an important point to consider with this pathway. We've measured this by reviewing the return and completion rates for questionnaires. And at the time of evaluation, we had a high return and completion rate for the questionnaires. This is important because if people don't return their questionnaires or don't complete them fully, we won't know necessarily if they're struggling and may need more support. We also conducted a small audit and found that the home-based care pathway met 93% of the Parkinson's UK national audit criteria. This was higher than the national average, which was great, but it also highlighted areas that we weren't capturing, such as monitoring people's blood pressure. We've since updated the pathway now to help capture more information like this and to help make sure that the pathway continues to be safe. When looking at the effectiveness of the home-based care pathway, we looked at the change in symptoms reported from baseline to 6 months. Using paired data, we found a reduction in severe or very severe non-motor symptom burden, a reduction in sleep issues, and a reduction in clinically significant anxiety. There, however, wasn't a change in the depression scores from baseline to 6 months. Our most recent evaluation has shown that there was little to no change in the UPDRS motor questionnaire and the quality of life measures. Interestingly, there was also little to no change in people's understanding of Parkinson's, their ability to self-manage, or their understanding of when to ask for help. Now, this was interesting because it contrasts to our earlier evaluation this year, where there were improvements in each of these areas. So we were thinking about why that may be, and one of the factors that we expect to have affected these measures is people's prior experience with Parkinson's care. So when we first started this pathway, we were including people that had just been transferred from standard clinical care. So they'd been in clinical care for a number of years, whereas more recently we've been sort of recruiting people from the new patient pathway, so people that are newly diagnosed. So the next steps for this evaluation are to separate that data from those who joined from standard care and those who joined from the new patient pathway, just to see how this affects their understanding of Parkinson's and ability to self-manage. So the other point from the effectiveness measures was people's opinion of their Parkinson's service. So at baseline, people felt that their service was starting to improve now that they were on the home-based care pathway. And after 6 months, less people felt that it was improving and more people felt that it was instead already good. So that was quite promising. So that's an overview of the home-based care pathway and where we're at now. We're hoping to keep developing the pathway by making care more personalised and tailored to individuals, while also implementing the new updated resources. We're going to keep training people who are suitable for the pathway and want to be on the pathway, and we're going to keep evaluating as well. We're also considering more ways that we can encourage people to self-manage while still feeling supported by their care team. Okay, and that's me done. So thank you for listening.
I'll ask Emma Edwards to unmute yourself and share your desktop if you wouldn't mind.
Okay, hello everybody. Yes, my name's Emma and I'm a Parkinson's nurse in Plymouth community. I used to work in North and East Cornwall, so it's nice to see some familiar faces today. So I'm going to talk to you about the impact that this pathway's had on my Parkinson's service. And I certainly know a little bit about it, how it's impacting on the consultants' sort of caseload as well. Okay, so what was it like pre-home-based care pathway? So I have a caseload, and which I share with another colleague, of about 450 people in Plymouth. And I joined there in January 2019, and it was absolute chaos, I have to say. There was massive waiting lists to see people in routine follow-ups in outpatients. I think I'm being a bit kind here. I think the waiting list was sort of more towards 7 or 8 months to see people. We ran 2 clinics a week each, and it still didn't feel like we were getting through to seeing people that we needed. And something that was happening, and certainly in my experience before when I worked in Cornwall, was what we were finding was that people were doing really well. So they were coming in to see us, and actually things were really fine, and they were feeding back how they were feeling, and things were fine. And often it didn't sort of result in any medication changes, but they didn't want to give up their appointment because they didn't know when the next appointment was going to be. So that was often the case. Or on the other end of the spectrum, they were really, really poorly, and needed a huge amount of input, and they'd been saving up sort of all their queries and questions and potential meds changes for months and months and months. We also were trying to run a telephone clinic, but we weren't terribly responsive to that every day, perhaps once a week, which was sort of frustrating for us and frustrating for people. And the stress levels were very high, so high actually, that one of my colleagues went off quite poorly. Our hospital admissions seemed really high as well in Plymouth, to Derriford Hospital. We did an audit in July. We had about 40 people with Parkinson's that had been admitted. Interestingly, still with the same sort of things that when I had audited our service in 2010 in Cornwall, very similar things. And I think it's similar to the national picture, i.e. that it was an acute deterioration of symptoms, often brought on by an underlying urine infection or constipation. So urine infections were still number one reason why people were being admitted to hospital, or constipation and falls. So as I've already mentioned, the staff sickness was high. We had no administration either. So we were typing our own letters. So which was very frustrating actually. So I would be spending, out of my 5 days at work, 1.5 of those days typing letters, and it wasn't a good use of our time. So we just thought, well, there must be a better way of doing this. So I think it was back in 2018 actually, myself and Camille and a few other people have been having a think about how we could look at an alternative way of delivering care. We had applied to the Health Foundation to see if we could get a grant to look at just a different way of doing things. And then that we started off by having a few workshops with interested parties, and that sort of snowballed then into the home-based care pathway. So what is it like now? I don't know if you know about rock balancing or if you've ever done that before, but I thought that was quite an apt picture because things seem to be better. They seem to be more in balance. So in October 2019, we did the first teaching session to put people on this home-based care pathway. And what we have found between then and now is that our waiting lists have greatly reduced. And I know Dr. Carroll in Derriford is having a similar experience. So we've gone from about 6 to 8 months waiting list to about a fortnight. So people, I'll just say this now, not everybody on my caseload and my colleagues' caseload is on the home-based care pathway. This pathway is suitable for people in the early stages of Parkinson's, I would say, or when they're ticking along quite well, or perhaps when they're on quite a bit of medication, but perhaps we need to tweak it quite a lot. So not everyone is suitable for this pathway. So some people are still on regular face-to-face reviews, but that's it. But having people on the home-based care pathway has impacted on our waiting list. So our waiting lists are greatly reduced. So it's down to about a fortnight, and that's even quicker if people with Parkinson's can use things like Zoom or Attend Anywhere or MS Teams. We can see people, the same day if they can use that technology. Obviously, our telephone clinics still run, and we've dedicated 2 slots now in a week to telephone clinics. Our stress levels have reduced, and that was also across the board when we evaluated it, as Emma King was just sort of saying. We looked at stress levels of staff before we sort of implemented the home-based care pathway, and then afterwards, and they had come down. And also, just personally, I feel much more in control of things now, the way that they are. And we also have admin, so I've got a whole day and a half which I can dedicate to people with Parkinson's. We also found, so when I joined this team in 2019, we had a lot of unhappy people on the caseload, again, unhappy, not being seen regularly, not knowing when their appointments were, and feedback has really improved since then, and certainly, well, for everyone, not just people on the home-based care pathway, it's had this knock-on effect to other people. So we did the 2020 Parkinson's UK audit, and the service users that we audited rated us, 75% of them rated us as excellent, and the rest was good, which was pretty great. And also we had all that evidence from the evaluations that we were on the right track with this pathway. So for me, what I like about this pathway is that I can get in there to review the right people at the right time in the right place. It's just been brilliant. And I think people's trust in us has increased, especially for those that are on the home-based care pathway, because they know that they're going to be reviewed every 6 months. They know how to contact us. They know how quick we get back to people. Hopefully they know that they will be seen face-to-face really quickly if they need it. I think one of the fears to start with was that they would just be forgotten. So people on this new pathway don't want to go on it because even though I don't know when my next appointment is going to be, I'm on somebody's waiting list. For people on this pathway, we're trying to keep reassuring them, and hopefully they trust us now that they will be seen. So if they need it, they'll be seen. And for us in Plymouth, it's, if, like I said, we can do it the same day review over Zoom or whatever, or we can see those people sort of within a fortnight face to face. And again, we have switched the way that we're working in Plymouth so that we have 2 emergency face to face slots each week. So we say 2 weeks as a maximum to be seen, but often it's a lot quicker than that. For me as well, with the data that we get from people wearing the watch and filling in those non-major symptom questionnaires, it really supports my prescribing. So I'm a nurse prescriber, so I can make adjustments to your medication and give you a prescription for it. And now that we've got more data over a longer period of time, I feel a bit more comfortable in making those changes to medications. And also something that I found is that because the people on this pathway can also see their data, we're making more shared decisions, which I absolutely love. And in fact, I changed my paperwork. So for people that are on this, this whole pathway has made me think about relationships with people with Parkinson's. So I no longer write to their GP. So all my letters now go directly and is communicated directly to the person with Parkinson's, and I copy the GP and the consultant afterwards. Because we can target reviews now, we've stopped our outpatient appointments completely now. We may in time set them back up, but currently we have no outpatients. We do all home visits. So myself and my colleague will come out and see people. And like I said, we still do the online reviews, we still do the telephone clinics. But what we're finding now is that we can target the reviews for those people that need it. And being able to do a home visit, you get that such a better feel for what's going on with people. And it's pandemic proof. So this really came into its own during last year's plague year and this year a little bit. So obviously we were doing face-to-face training at the very beginning from October 2019. Blimmin' nightmare finding rooms for people for the training, and also car parks were a nightmare. So when the pandemic hit, everything got cancelled. Obviously that was face-to-face, and we moved to online training, which took us all a little bit of a while to kind of get our heads around, but we did, and because it's been so successful, we've carried that on. And also, everybody that is on the home-based care pathway did not miss a 6-monthly review at all during the pandemic. So hopefully we don't get another pandemic coming, but I can sort of wholeheartedly say that we survived it. So what's it going to be like in time to come? So as always, our caseload grows, and it's certainly looking in Plymouth that our geographical area may expand into West Devon. So I think this home-based care pathway is going to come into its own again, because certainly, well, we hope money comes with a wider geographical area, but it rarely does. So finding new ways of being able to respond to people when they need it, and also just to keep an eye on things regularly, this home-based care pathway is really helpful for that. As I just said, I think that Emma touched on as well is the future of the home-based care pathway. I think it will evolve. There's more wearable tech coming onto the market now for people with Parkinson's. I met with a company from Portugal the other day actually about an app for the phone which continually monitors people with Parkinson's. We're also developing our own app in Plymouth for monitoring non-motor symptoms. So I think the future is going to be technology. We will continue to sort of promote the self-management in Parkinson's. What we found with people on this pathway is that it's almost like they've been given permission to kind of take a bit more control over, and it tends to be those people that have the training, especially about the acute deterioration. They'll often phone us when they've had a look through their paperwork. They've, if something changes quickly, they'll have maybe tested their urine or taken their blood pressure. And when they've done those things and they still haven't come out with an answer, then they will call us. So again, they'll often have a lot of a bit more of awareness over their own condition. So yeah, what did I mean by that? Regular reviews for those that need it. Oh, that's it. So people on the home-based care pathway will obviously get their 6-monthly reviews, and they can contact us at any time between those reviews. But people that aren't on this home-based care pathway, we're still going to be offering regular reviews for those, and it's freed up a bit of time to be able to do that. And also, having the data that we get from this home-based care pathway, having the numbers is what commissioners look like when we're sort of planning our future service. So, all in all, it's been a really positive experience for me to be part of this home-based care pathway. And hopefully the people that are on it, that are on my caseload, feel very similar. Yeah, okay. So I think we'll probably be coming to questions shortly, so I will leave it for now. Thank you very much.
Yeah, thanks, Emma, to both Emmas. I think, yes, we come to a question and answer session. My colleague Nigel said he's kind enough to take us through that. So I see there were a couple of questions were fielded in chat, so maybe that'll trigger a few others.
Thanks, Ollie. I'll take over. Yes, I've got a question from myself actually to kick off. Is the system being shared with Trust across the whole of the Southwest?
Okay, so currently it's for people that are under the Derriford footprint. So that is East Cornwall, a little bit of North Cornwall, Plymouth Community and West Devon. So we are hoping in our world domination plans to kind of spread it across the UK. But at the moment, it's just that area. And that is partly because Dr. Carroll is one of the is the main person that analyses the data from the PKG watch and the questionnaires. And she also has access to the notes of those people. So, for example, if it was somebody from Falmouth on this pathway, we wouldn't have all the information that we need. So currently, it's the Devon, it's the Derriford Hospital footprint.
Okay, thank you. And a question from Sue Whips. Can you explain the newly diagnosed course for people with Parkinson's in Plymouth?
I think what Emma King was referring to is that the new patient pathway? Is that what?
Yeah, that's the one I was referring to. That's where more recently people have been coming onto the home-based care pathway from. So rather than going straight into a clinical waiting list, if people are suitable and keen to do so, they'll be referred straight onto the home-based care pathway.
So the new patient pathway, if people don't know that, is so in Plymouth and West Devon and East Cornwall, when someone is diagnosed with Parkinson's or likely Parkinson's by a consultant, they are fed into the new patient pathway, which is run by the inpatient Parkinson's nurses in Plymouth, in Derriford Hospital. So it's not us in the community, it's the inpatient nurses. Emma Pearson, used to be Fiona, Kevin is there as well. And they are on that pathway for the first year of their diagnosis. And in that year, they are seen, this is pre-COVID, so things have changed a little bit. They should be seen a couple of times. They will have worn the PKG watch during that first year of diagnosis. They will be signposted to things like physiotherapy, to Parkinson's UK, the local Parkinson's UK advisor, anything that kind of comes up and seems relevant and appropriate to them. And they'll also be usually started on medication. So by the time they come over to the home-based care pathway or come over to us in the community, sort of on the kind of the usual pathway, they'll have sort of had a lot of input by that point. Yeah.
That's great, thank you. And a further question from my colleague Ian O'Neill. Financial implications. Is there a significant cost saving by using the pathway?
Emma, do you have the
Yeah,
answer?
I'll take that one. So we haven't done a formal health economic evaluation, but we did some estimates. So before the resources were rewritten, they're a little bit cheaper now because we condensed them, but we estimated that the first year of home-based care would be about £680 per participant. And then subsequent years would be nearer 480 because you wouldn't have the training sessions and you wouldn't have the resources, but they wouldn't be resupplied each year. It is very much an estimate, and we compared that with an estimate of being seen up to once a year by a sort of a consultant, sort of £200 on standard care. So just looking at it straight away, it is more expensive, but we expect there to be some savings elsewhere. So as Emma mentioned before, sort of less hospital admissions, and just by people self-managing a bit more, less need for admissions like that. I'm sure there were other health cost savings that I had in my mind, but they've escaped me at the minute. But I'm fairly certain the admissions was one of the.
Yeah, absolutely, and sort of like sustainability. Again, it was that saving, or not that save. Well, I suppose it is a saving of reduced clinical travel, which then there's not so much petrol and diesel going into the atmosphere. There's I think you might have put that together, Emma, about that we've perhaps saved 2.10 metric tons of CO2 from the reduced clinical reduced clinic travel. So that's really helpful for the environment. And like I said, certainly I've gone from going to Plymouth. So I'm based in Bodmin. I live in Bodmin, but from going to Plymouth 4 to 5 days a week, I can target my reviews twice a week. So I go to Plymouth twice a week, and then I work from home doing telephone and virtual clinics on the other 2 days. So certainly there's a massive less travel for me. And also because I'm seeing my patients at home, there's no travel for them. So
that's great. That's a great explanation. Thank you very much. A question from Laura Miller. Will you be talking about this process through the Excellence Network?
Yes, of course. We've is there a particular event that we can talk at? I know certainly we've put this for recognition on one of the Excellent Network awards. So hopefully we can get some sort of getting the word out there that way.
A question from Uli Funken. What is the process to get on the pathway in your district?
Okay, so that's really easy. So for some people, so those people that are on the new patient pathway, as I've already said about, they can be referred straight on to the new patient to the home-based care pathway from that Emma Pearson that runs that service. Or you can simply ask your Parkinson's nurse. So if you live in East Cornwall, Plymouth Community or West Devon, you can ask your Parkinson's nurse or your consultant, if you can get hold of them, if they can go on to the home-based care pathway, and then we'll arrange it from there.
That's great. Thank you very much.
You will be expected, sorry, just to interrupt, just important thing, you will be expected to attend an online training event, which lasts, I think it's about an hour, isn't it, Emma? Hour and a quarter?
Yeah, usually about an hour, depending on questions.
And then you'll be sent out that the PKG watch to wear, and then you're on it.
Fantastic. Thank you very much. Sue reflects that since her husband John was diagnosed, they've had 5 consultants, 3 PD nurses. Sue thinks, and I think we all would believe, that this builds continuity into the future process for people with Parkinson's, but do you think that's correct? Either of you?
So can you just say the question again? Are you looking, so is it about continuity?
Yes, I mean the whole notion of the home-based care pathway seems to sort of suggest continuity, and really Sue was wondering, do you think that's going to be the case?
Yeah, absolutely, because the structure is there, isn't it? So even if I'm replaced, which obviously I'm irreplaceable, but if I am replaced, the structure for the home-based care pathway will still be there. So there will still be somebody, we've got it, so it's set that the reports will be read, the report will be written and sent to the person with the condition, their GP, and their Parkinson's nurse, whoever that Parkinson's nurse is. So it, hopefully there'll be no disruption if staff change.
I'm not entirely clear. Is this funded by the hospital trusts or by the commissioning groups? So, for example, if this was in Cornwall, would this be paid for by the hospital trust in Cornwall, or trusts plural, or would it be the responsibility of the GP commissioning groups to put this service in place?
That's an interesting question. So currently, like I said, we did win the award from the Health Foundation, which gave us a really good financial starting point. So the resources, the learning materials, we were able to take from that pot of money. Ongoing, it's currently funded by Derriford Hospital, and the obviously. So the PKG watches are, am I right in thinking with this, Emma, that it's Derriford that is currently paying for it? I don't think it doesn't come out of any GP pocket.
No, I'm fairly certain it is Derriford that's paying for that.
So I work for Livewell, which is the community arm of the health services in Plymouth, and certainly it doesn't come out of my budget directly. However, the time for me to go out and see people, that comes out of, we're commissioned to do that. So sort of led by Derriford, but sort of the out a bit by the GP commissioners in terms of my time. But then that's my post.
If I might give an immediate consumer reaction to this, I would say, well, why wouldn't we want this in Cornwall? So the question that is going to arise is, okay, so how is this going to happen? Who has to speak to whom and raise what levels of cane in order to make this more widespread? Now, I'm obviously asking the question in the context of Cornwall because that's where we happen to live. But this must apply elsewhere in the country. How does this get adopted elsewhere?
So we're currently looking at that, and we've had interested teams from around the country speak to us, and a lot of teams across the country are already using the PKG watch to support their care decisions. So we've had really positive feedback. So the teams have to be motivated to work in a different way. And sometimes what we found is there's comfort in chaos, that although the system doesn't work, it's a system that they're used to. So we really had to come out of our comfort zone as a Parkinson's team to adopt this way of working. And it really has worked. The benefits are there. It does take time, obviously, to read and analyse the data that we receive. However, if we're not bogged down with so many routine reviews by people that are doing really, really well, we have the time to do it. But it does take motivation, real motivation and support to work in a different way. We are looking actually to see, because obviously the PKG watch comes at a cost. I think it's about £175 a report. And we are looking at other ways that we could, evaluate motor symptoms in the community. But the PKG, we keep coming back that it is such a useful tool to use. And I think the NICE guidelines have sort of supported that as well recently. But I don't know, for the benefits that come out of it, I think if there is that initial setup cost and maybe an ongoing cost, I'm hoping that will level out it for the teams in the future. So we do online training anyway. We do online, and other areas of the country should be doing online reviews with their patients. They should be delivering online training regularly with their patients. So it shouldn't be too much of a leap to be able to take on this way of working. And like I said, it's not for everybody. So for some people with Parkinson's that need closer monitoring, this pathway is not going to work for them. But for people in the earlier stages, in that maintenance stage, even going into the more complex stage, so I've got people that are doing well on this pathway, but they're going up to Bristol soon for assessment for deep brain stimulation and duodopa. And I can't see a reason why in the next few years why they can't stay on this home-based care pathway. So it's so useful that we hope that we can spread the word, but the teams that take it on have to be motivated to change.
So I think we come to the end of the field question. Anybody else has any comments or questions, burning questions? I think, Laura, you still have your hand raised. I'm not sure if that was from the previous question or if you wanted to talk some more.
No, I just wanted to say I'm not from Cornwall. I actually live in Buckinghamshire, and I'm really grateful to have had the opportunity to join this meeting. I think what you're doing is absolutely fantastic. And I think if it was available in other parts of the country, it would be just so good for people with Parkinson's, because I can see the benefits both to the nurses and the NHS and to the way many of us are supported. And I love the idea of having the ability to build up reports of your symptoms and how they fluctuate, and use technology and use telemedicine, which are all quite hot topics at the moment. So I don't know if anyone in this area in the NHS has looked at this or has thought about it, but would it be okay for me to talk to my nurse about it and put her in touch with you if she was going to find out?
I would be delighted to talk to any nurses from around the country, and I've done it several times as well. And they've all loved the system as well. But again, it's that motivation to want to really change. But yes, I'm sure one of the people running this presentation today has got my email address, and I'd be happy to share that with you, Laurel, and you can share it with your nurse as well.
Great, thank you very much. Thanks.
Follow on from Laurel, it's up to patients to produce a groundswell, first of all, of discontent, bring that to the consultant's eyes, and to offer this video and others that are less short in a way, and perhaps singly presented by a consultant, to give them the evidence that it's working. And by all means, everybody share this video link when it's live to everybody far and wide. I know I will be on all my Facebook groups. Thank you.
I think we're just about out of time now. So I'd like to thank the two Emmas for not only being with us, but also spending years and years of your life in developing this. And it is a great initiative, as Laura said, and hopefully we'll create that wave that Sue was referring to, that swell. So yeah, thanks very much also for the Penprick team that's put all their hours of voluntary work into this to make this happen. And lastly, thanks for the people who've dialed in from various parts of the country and showed interest in what we're doing here. So really appreciate you coming to talk to us. Thanks very much.